We're just going to go over the various COVID package. I'm going to give an outline of the session. Before I do that, just to get everyone on the same page, I'll give a brief overview before we get into the demo. One thing I wanted to do is talk about the various data models that we will be discussing in this presentation, just so we're all on the same page as we discuss these various topics. So we'll be discussing three types of packages that we have developed and that we're offering, essentially, throughout this presentation, and that we will also be demoing. So I just wanted to kind of go through them real quick so everyone understands what we're referring to when we do talk about them. So the three data models that we'll be discussing, the three kind of package types that we have are for tracker, events, and aggregate. And you will see these words come up in the documentation as well as during this presentation. And if you're thinking about which one to use, there's also important considerations here. So for tracker, when we're discussing the various tracker packages, what we're discussing is a series of discrete processes. So these are, they're kind of linked processes that occur together, but one at a time. So what the tracker programs allow you to do is they actually allow you to follow a single individual as they interact with each of these separate processes and come up with kind of a holistic summary of that individual's interactions of these different processes. So a classic example of this would maybe be something like a mother attending antenatal care or a child going for vaccination services, and you want to record all the different interactions they have with the health system over those various events that they're visiting the health facilities and receiving services. We also have event packages, and event packages are a single discrete process. So they're not a series of processes that we link together. They're just kind of one-off single processes that just occur once, okay? They're not really where you're involving tracking an individual so much, but they are dealing with individual data. So, you're having maybe a line list of some kind, but we're not really entering much demographic details or any identifying details at least, and we're not able to kind of search for that person multiple times as they come back to the facility. And then the last kind of package or model that we'll be talking about is aggregate, the aggregate model. And this is counts of data. And I think many of you will be familiar with this if you use DHIS2, but this is not involving individual data of any kind. This is a summary of the information that is then being entered into DHIS2. Okay, so we'll be talking about a couple different packages, as I mentioned. For COVID-19, these are kind of the areas that we've outlined that we think are kind of where we're kind of spending our development efforts, making sure that we at least meet these requirements. And each of these are kind of outlined by various models that I just discussed. So these three programs, we'll be presenting all these three programs in a demo session very shortly. The clinical examination, lab testing and outcome, port of entry screening, community follow-up, and contact tracing. These are all using this tracker model, right? So where we can actually follow this individual as they attend various kind of processes within these kind of programs. We also have an outbreak line listing. This is an event program. So, when you kind of get to the point where your threshold is increased, you have so many cases, dealing with tracker might become difficult. And we also offer this event program. And then we also have an aggregate program. And this is basically a summary, counts of information of this clinical examination, lab testing, and outcome. Okay, so as Kristen mentioned, we are using a lot of standard guidance tools in order to guide us. And you can see here, actually, there's even guidance just released on March 20th, updated guidance. So we're making sure to refer to all of this as we kind of develop our tools, okay? So everything that we're kind of showing is based a lot on these various standardized guidance and tools that are being offered by WHO, right? So I'm going to get into the demo now. That was just a very brief intro. We're going to have a number of presenters throughout this session. So I'm going to go over the clinical examination, lab testing, outcome, contact tracing session for tracker. I'm going to hand it over to my colleague Yuri after that, who will talk about ports of entry as well as the event line listing. And then we have Patrick, who's going to present the aggregate package. Hopefully, if we have a little bit of time, I can also do a bit of an Android demonstration. And then I'll hand it over to Rebecca, who will discuss some of our resources that we have, as well as next steps, and kind of wrap up the session for us. Okay. So I'm going to go ahead and jump into the demo. Okay, so as I mentioned, I'm going to be talking about the clinical examination lab diagnosis outcome program, as well as the contact tracing program. We have dashboards available for all of these different packages. I'm going to discuss that in a moment. I'm just going to kind of go over the program a little bit itself, so we can see where all this data is actually coming from. All right, so as I mentioned, this kind of model allows you to follow individuals, etc. So we actually have this process where we would register this individual if they're not already existing in the system. So if this individual, if I'm faced with a new case in my clinic, then I would actually go through the process of registering them so I could search for them and follow them up on subsequent parts of this process. I'm not going to go through entering all the details now, but I just wanted to kind of show you how this was done. We just take their demographic details essentially, and we plot them in here so we can find them later on. What I'm going to do is go to a case where some information has been filled out, so it's a bit more interesting. So you can see that we can find people who have already been registered or gone through this process. This is a person where some of the details have already been filled in for her. She has, various demographic information associated with her that would allow me to find her, including an ID number, first name, last name, her gender or sex, as well as other identifiers we can use to follow or find that individual. But what I wanted to talk about more was actually the structure of this program that we have. So there are basically kind of four processes, if we want to call them, or four different kind of events that occur within this program. Okay, so we have a clinical examination and diagnosis. This is the first part. So after you register this person, maybe this is something that would be done in the facility immediately after they're registered, or if you're doing data entry maybe after. This would be kind of the first part that you're interacting with them. And this is the kind of longest part of the program. So there's a lot of different sections. And as I mentioned, this is all taken from the WHO guidance that we've been looking at. So all of this information, there's sections on the signs and symptoms. You can see we only have kind of signs and symptoms for COVID-19. We know that there's a lot of other symptoms that can be potentially monitored, but the idea was to really find out the suspected cases of COVID and kind of be discreet and small in terms of the scope of what we're trying to capture. But we do have other symptoms, and I'll show you that later on for other programs. Then we have pregnancy details. This section only appears if they're female. We have all kinds of underlying conditions. This is also part of the WHO case reporting form. Very important for those who eventually get hospitalized, if they do get hospitalized. There's a section on hospitalization as well. And you can see there's all kinds of various data items here, and exposure risk. So this is mostly dealing about if they've been in contact with previous cases or other cases, as well as if they've attended a health facility of any kind. And then the travel history. So the travel history, obviously, as we know, this is playing a big part in the outbreak. So we basically have all kinds of country lists where we can identify where they have been and try to identify the most likely country where they were exposed if they have traveled overseas. This one at the bottom here, you'll see this assigned date of onset of symptoms. I'll come back to that in a moment when we discuss the dashboard and the indicators, etc. So we have the second kind of process within this overall program. This is the lab request. So this is much more of a operational kind of process where someone is actually requesting that a lab result be undertook based on the samples that they collect from the individual if they are performing lab testing. So basically what this would do is you'd be able to allow to collect the result, you'd be able to notify the people who need to conduct the lab test that you are sending them a specimen perhaps, and then they would be informed that they would have to actually perform that test. Okay. Then we have this lab result stage. This is just very simple. You can see that the lab request and lab result, there are very few variables. they're not kind of encompassing. This is not meant to be kind of a encompassing lab system, but it's really meant to be just a summary, real quick summary of the initial request as well as the results, so we can identify those cases that test positive, right? So that's what we are kind of interested in, the type of testing they're doing, and then the test results as well, in order to be able to classify our cases. And lastly, we have the health outcome. You can see that this is also very simple. This can occur sometime in the future. As a result, you need to find this person when you are conducting that outcome, whether it be in 14 days perhaps, or maybe even a bit more than that, depending on the processes that you guys are following. So we do need to be able to follow this person, basically, find out each of their pieces of information, and then subsequently be able to enter them in this various processes that we've defined. All right, now as a part of this, we would also have this kind of contact tracing. These are very closely linked, and actually they're also linked with the other tracker program that my colleague Yuri will be presenting, but I thought it might be useful just to present it at this point in time. On the right side, you can see that there's kind of a list of actually individuals that this person has been in contact with. And what we have set up basically is a separate program, a separate tracker program that allows you to register these contacts and subsequently link them to the index case. So we can see in this case, this person is the index case, and then this is all the different people that she has been in contact with. So what we have done, there's a separate program, contact registration and follow-up, and I'll actually go into that program in a moment. But first, I'll just register a contact just to show you that process. So we have this kind of relationships feature, which allows us to, in this use case, in this COVID-19 package, register additional contacts that the person has been in contact with. So I could just, I can do this right from this person's kind of data entry page. So I'll say they've been in contact with someone in the contact registration. So if someone already exists, you could just click on them basically and add them as a contact for this person. But if it doesn't exist, which is maybe likely in a lot of cases, you can actually proceed to register a new person. And once again, we're collecting all kinds of demographic data on that person because we might potentially have to follow up with that contact, assess their symptoms, whatever various processes that you're doing with the contact in terms of your contact tracing scenarios. So I'll just enter someone very, very quickly. I won't enter everything just for the sake of time, and I'll save that. Okay. And you can see that now that this extra person that I've just registered is now another contact that exists and is related to my index case. Okay, so I'll click on Sam here that I just put in here. Okay, and I'll change over to the contact registration program. And we can see it starts as a very simple program. And this has two discrete processes, follow-up and symptoms. So if I go here and just enter some data, let's say no, okay. Just gives me some fields to fill in, okay. Sure, let's see here, okay. Now, the reason we've separated these two processes is because this symptoms process is actually, it can be done multiple times. So if you're monitoring contact and seeing if they develop symptoms over time, so let's say we start and they say no, and then we come back and we do it again at another date, and then we say yes, okay, then we are able to actually enter which symptoms they appear. And the advantage of having it this way, so if they do develop symptoms, if they do then need to be kind of monitored and have a lab sample taken, maybe other pieces of work done based on their assessment, then we can actually then subsequently basically say that, okay, well, they've been assessed, let's send them to a facility. They now need to be kind of put in our original program, our case-based surveillance program. So I can take Sam here and I can then say, okay, well, he has symptoms now. He was a contact of Dana, but now I want to place him in this program as well. So you can see it'll just take his details that we've already entered. We don't need to re-enter anything that we already have. We can then place them in this program as well. So the advantage of having both of these programs in the same system becomes clear pretty quickly. And then we can go and subsequently enter in all the related details and information for this particular person in this program as well. All right, so that was just a very quick overview of these two programs, the case-based surveillance and the contact tracing and follow-up program. And what I wanted to do is just really quickly go over the dashboards that are related to these two programs. So I'm just going to go back. So for this program, you can see that, so we've tried to identify the data source of each of the dashboards that we have. I'll let my colleagues discuss the other dashboards as they talk about, the various programs and items that they will be discussing. So for the case-based surveillance tracker, we have two dashboards set up, and actually also a number of indicators that are not on the dashboard necessarily, but are available to be used for analyzing data at a kind of more granular level, including age and sex disaggregations and some other interesting indicators that can be used for analysis. So for these maps, what these maps are actually showing is the location of the home location of a case. So this one is suspected cases by their home location. During that process of collecting data, we can also collect their location, and then we can map that information like we're seeing here. So we can apply, interesting disaggregations of this data on the map. You can see here, there's a color scheme applied to disaggregate by sex, for example. And this is actually the suspected cases by their home location. We also have one for the lab confirmed cases, if I just zoom in a bit. And then at the bottom, the suspected cases with symptoms. So these are just some examples of what's possible using these maps to kind of present these cases and where they're from. We also have a kind of overall dashboard that has all kinds of various outputs. I'm not going to discuss each one, but I did say I'd come back to this, this date of onset of symptoms variable that was shown in the first stage of our program, the first process of our program when we did the clinical exam. So what this is actually for, so you see here total confirmed and probable cases by date of onset of symptoms. So what we have is, you might have noticed in some publications where they have basically charts comparing the kind of epi curve that shows reporting date versus the date of onset of symptoms, right? And traditionally in those curves, you will see quite a large delay between the actual onset of symptoms and the reporting date. So what we're trying to do is offer, using the onset of symptoms, when it's available at least, to be able to plot our cases. So rather than using the reporting date, which could be maybe a couple days after their date of onset of symptoms occurs, we try to use the date of onset of symptoms where possible to actually plot out our various data. So we're seeing a bit more accurate curve of the outbreak as it progresses over time. That being said, we can of course display the data by the reporting date as well. But we just wanted to make sure that we offered both facilities for that. So that is what that date of onset of symptoms allows us to do with all the various data that is captured. Yeah, you can see here just underneath, there's one for date of onset of symptoms versus the reporting date, for example. We don't have much data now. We are going to improve this significantly over the coming days, where we will have more demo data for people to have a look at and utilize this with. So yeah, there's just a couple outputs on suspected cases, imported and local transmission, deaths, and there's a number of other indicators that are available, and there's documentation available to look at to kind of go over that in a lot more detail. Okay, I'm going to end there for now. If there are any questions, as Max mentioned, can post them in the chat, or also we do recommend the community of practice if possible, and we can address those. But I'm going to hand it over to Yuri now, who's going to talk about the ports of entry screening, as well as the event line listing program that we've been working
on. Hello, everyone. Thank you, Nick, and thank you for the detailed presentation. I will take over from you here, and will present the port of entry tracker. We would like to say thank you to Sri Lanka to providing us the information on that module. We have adopted it. And here you see the dashboard of that particular program. It is not finalized yet, but you see the main indicators there, but I will get back to that. So just like Nick did, I will show you how that program works. So, and here I will actually go to the registration stage. So when it comes to the port of entry screening, the first question that might arise is that where this takes place. So it could be an airport, be a harbor, or it could be a border crossing, and which facility will take on that information. So our enrolling organization unit here in the demo is our top level training land, but this could be either a local medical facility or a certain assigned medical facility to treat suspected COVID cases. It could be a facility or organization unit within the airport or border crossing that could deal with that. So, but this, when the person is enrolled into that program, you will decide here which facility that person is enrolled in. We do collect the demographic data that you are familiar with from the health forms that you fill in when you travel across borders, as well as the emergency contact details. And I will just enter just some basic data here. And right here on the registration form, we also have the basic information on the travel information and the examination that might take place at the port of entry. So let's see, it is today's date, and there's a lot of information to fill in about where that person is arriving from and where the person started the journey, reason for traveling. We do collect data about the countries that the person visited and also the contacts that that person had, and we ask for symptoms or signs of flu. So if the person has no symptoms and the measured temperature allows us to release that person or to clear that person straight away, we can do that here by completing case cleared. In this case, we are prompted to complete the enrollment for that person, and by doing that, we kind of make the workflow faster so that we don't have to return to that person anymore. However, if the person does show symptoms and we do want to follow up, we can continue doing so in the next stages of this program, which are called the follow-up stages. So here we have that basic information we just collected. And for the follow-up stage, let's say if there's a need to follow up within the 14 days, and some countries are doing that on a regular basis, we will create a follow-up stage here. So let's say if the person shows any signs of symptoms within that period of time, again, high fever, we might want to refer that person to another facility. So by referral, what do we understand here in this program? So we can use a referral location right here in the program stage just for analytics purposes. So I could say that this person is referred to an organization unit that will continue follow up on that person, or that person has to report to that facility. We can also use the functionality within the DHIS2 to actually refer to move that person that we are following up to a certain facility by assigning him or her to a facility, which will move all the information and data about that person to that facility, and they will be notified and able to enroll that person in the case surveillance program if needed. We also have the second stage of follow-up, which is the follow-up after the 14 days. And here we also have the possibility to record the symptoms if present and see if that person needs to be referred. And if there is no need for any further action, we can also clear the case here. By doing so, we will remove that person from the suspected cases on our analytics indicators. So before I'll show you all the possible indicators that we can pull out from this program, I will also just mention that here we can add relationships as well to our if we can choose if that person has been in contact with anyone, we can list it here and follow up. So back to the dashboards, we can see that here we can see how many people or travelers were screened in total, and we can change the periods, and we can also disaggregate by countries of their boarding, where they came from. We can also include all kind of data whether they presented any symptoms at the point of entry, and so on and so forth. Here we have an information about how many travels were cleared, how many travels were referred to different facilities, the total number of referrals, how many people are under follow-up at the moment, and here we can also see the cleared and referred passengers or travelers within the 14 days. But the amount of indicators that we have actually is a lot more than what we can see here, and it's all included in the documentation. So this was the third tracker program that we have, and I will now move to the event program, which is the kind of the line listing program that will be implemented if the flow of the cases is high and you don't have time to or need requirement to follow up on them. So what I will show you is in the capture app here. Again, when we deal with the events, Nick has already mentioned that we do not collect all that much demographic information on the cases, but just record a single event. And you will see how this is done here. So I will select the facility where that person or that case will be registered, and I will select the program for it. You see here there is a list of the events of the cases that have been already registered. This program allows you basic tracking. So you can filter these registered events by, let's say, completed or still active. You could add more filters. Let's say return back to the date of onset of symptoms. So I can see the cases by the date of onset of symptoms. I can also filter them by laboratory tests and see, okay, have these cases been laboratory tested? And now, of course, the most important one is the status, whether the case has been completed or not. So but let me just register a new case so you'll see what data we're capturing here. Basically, it's the date of the report, which I will use as today. And normally, you see we are just capturing the basic information about the sex and the age of the person. We do not capture the first name and the last name due to well, this is not the right program to do so, but it is of course possible. So if the person shows any signs of or symptoms, we can enter the date of onset of symptoms. And you see here that our date of the report is 26th of March. So at the bottom, similar to the tracker program, we have the assigned date of symptoms. So unless the date of symptoms is assigned or it exists, the report date will be registered here. But if we have the date of onset of symptoms, the date will change. We record the case severity, where it's mild, moderate, severe, or critical. And we just record the basic information on the laboratory tests. So basically whether the person's been tested or not. If the person was tested, we just want the final results. We do not enter any information how many tests have been performed. We just want the final results. So let's say if the final results is inconclusive, our case is classified as a probable case. We record the exposures. We also are interested in the infection source. So let's say if the person has traveled, it can be an imported case or local transmission, or we don't know the exposure. If the person has not traveled, then it's likely a local transmission or exposure unknown. And if it is local transmission, we are interested in where that could happen, whether it was a community or household health care facility. We also record whether this is the new index type or whether this case is linked to an existing cluster. So record basic information whether the case has been hospitalized and received the care in an intensive care unit, and record the health outcome. So at this stage, we can complete the event if we've collected all the information that we needed, but we can also save the information the way it is and just keep that case as active in case we need to return back, let's say, to record the test result if needed. This is it about the event program. I'll just go back to the dashboards and show you the some indicators that we have created here. We record the total suspected cases, laboratory confirmed cases, deaths. We also have the charts by onset of symptoms. We disaggregate by confirmed cases, probable cases, and suspected cases, and so on and so forth. Again, the number of indicators that we have in the program is more than you can see here. And again, If you have any questions about this program, feel free to post these questions on the community of practice. So I will thank you very much for listening, and I will hand over to my colleagues now.
Okay, so I believe it's Patrick up next. Is that right?
Oh, yes, please help me. Oh, I'm good now. Okay. Oh, hi, everyone. This is Patrick, and let me just share my screen. Yes, so this is Patrick, and I'm here to share with you on I would call it the last option for this kind of implementation, and this one you're looking at Aggregate. Like Nick said, it would be nice to do tracker, and then the other option would be events, but also for me the last option then would be, if you cannot do all the others, then at least try and do Aggregate. And for Aggregate, we're really working with minimal data set, and this data set has about 11 data elements, as you can see on my screen. And for this data set, for this demo and for this package, what we've done is we have used the guidance that we got from WHO again, and we have and this is what we have so far. So for now, we are thinking that one may want to collect data at facility level. And so this data set is attached at the facility level. But again, one can choose to have maybe at a district level, and then be able to choose when either to do it weekly or daily. But for now, we've also put it daily. So as countries adapt to this, they can make that choice. So here, the data elements you have are really minimal, like I said, and with these disaggregations. So the first section of this data set is looking at, of course, cases reported and deaths. And for the cases reported, we are looking at the two types of cases: the suspected case, where one would say the probable cases, or and confirmed cases. And then we're also looking at cases that recovered, and then of course the new deaths that are reported. So this is being disaggregated by gender and by age. But again, we've got the latest guidance, and this age that you're seeing here has changed, and we should be able to commit that change very soon. Now they're looking at sort of a 10-year age band, where you're looking from 0 to 4, and then 5 to 14, 15, up to 85. So this is likely going to change. Okay, this has changed. We are just going to commit it. So this is the first part, and this is how we are disaggregating it. We are also, for Aggregate, interested in looking at the tests conducted and the cases that are hospitalized. So, and here we are not really disaggregating by gender or age. And so this is what we're capturing for that. And then we are looking at the cases treated. And here we're also looking at the modes of treatment. And these are the different modes we're disaggregating those treated with. I mean, the different modes of treatment for those cases that are treated. So this is disaggregation that we're using. And then the last section is looking at, again, cases by the transmission classifications. And again, we are looking at whether cases are imported, whether it's a new class, I mean, a known cluster, whether it's community transmission, and there are those that, of course, sometimes that are not known. So this is really the form. It's simple as that. And out of these, of course, we've come up with a number of indicators. Let me just show that to you. So we have about 20 indicators, and this is on the new one we have 20, but for now we have 15 here. So this list keeps growing as the need arises, and of course most of these indicators are really we have a few that are of proportion, and most of them are really numbers. And they're just to try and help us have the vision. And again, the reason we're trying to create these indicators, most of our the analysis outputs that we were able to see is really based on indicator of data and then analysis. So you can have two packages. One that, so for countries that are able to actually, or have data already, then they can simply map and they have the visuals that I'm going to show you shortly. So having indicators here and mapping that the indicators to our data elements is very important, because then we can separate. But for now, it's all in one. And if you want to implement, you can implement all in one. But just know that in case you make a choice, say, I just simply want to have analysis, I already have this data collected somewhere in my local instance, then we can help with the mapping to these indicators, and then you'll have the same visual that you're able to see. So, so for now, of course, we have only one data set. This is a data set, but again, with the revisions that we made, we are going to have another data set that will be sitting at the region. That will be helping us look at the transmission patterns. But again, that will come later. For now, we only have one data set in the demo. And then finally, on the validation, we've done something on validation. Oh, validation rule, we don't have it here. But we did something on validation, but again, we are still wondering how, whether it's necessary to have some of those validation rules enforced. Looking at some of the way the data comes. For instance, in a given day, if you want to, if I go back to data capture here, just try and explain the validation rules and the likely issues that you're going to have with the validation rules. So with the validation rules, we've tried to create some, but again, we're enforcing can be a problem, because on a given date, you may have more deaths than probably new cases that you have got. So if you're trying to validate cases reported on that given date with death, you may have issues, because sometimes you may have death being more than the cases that are reported. So when you're trying to create these validation rules and enforcing them, we have to be a bit careful. So we've some ideas of some validation rules, which for now we are not going to enforce. So, so that's the simple data set that we have for the aggregate. Now going to the dashboard, we have created a number of items on the dashboard. And this is a dashboard that we created. So here we are looking at quite a number of things on the dashboard, and again, this can change. If you taking this up, you can choose to use some of these or make the changes as you need. And again, we keep on inputs on how this should look like. So here what we have is you can have cumulative number of cases and have some kind of a cascade, whereby you have all cases reported, those that are confirmed, then you can look at those who have been treated, hospitalized, and death. So that kind of cascade can be a good one for you to look at. You can also try and compare deaths with cases confirmed and have some kind of a trend. Again, here we are looking at it on daily basis, depending on how you would want to look at this. And I think the more frequent, the better. We can also look at cases that are active versus those that are closed. And so the blue one, you can see up here, maybe those that are active. Again, this is dummy data, so it may not give the impression. So that is, and here we're using a stack bar to sort of show this. You can also look at where you're also still using a stack bar, but trying to look at the different age groups to look at where you have more cases. And so again, here you can have this on daily basis so that you're able to see the trends. So here again, it can be a very nice one to look at. We're also looking at here cases that recover, the fatality rate versus recovery rate. You could also do that comparison. I have this map that's not showing, but I think because we said last week and our data is a bit old to show this. So you should be able to have a map, and you could have many more maps. This is just for this. This is the one that you're able to create, but you could have many more maps on your dashboards. You could also do a pivot table, and here we are trying to look at recovery rate and also fatality rate. And here you're able to look at by the different age groups, by sex. So you could have this on your pivot table. And here we're able to look at also the different treatment modes. And this one we use the pie chart. We could also use area chart to sort of show again the deaths for the different age groups. And here we're looking at again case closed by the different organization units. Here we're looking at by district. You could try and compare which districts maybe still have active cases, and maybe which ones have more that are closed, so you're able to compare that. And again, here the other last pie chart we have is looking at the classification of transmission, and here you can actually see which ones where you're getting more cases. So this is also a good one to look at. And then you could have also another pivot table that is able to show you. You can have much more now on the pivot table here for the different, look at all the cases and then by gender and have a little more detail here. And then the last one here, you could also look at some analysis on gender. Looking at the changes that we've made, a few changes have happened on this dashboard, and as soon as we have them ready, we should be able to have it published soon so that you can have that in the revised package. I must say that this has really changed, and I think Rebecca will mention when we are going to have that published so that you can access, because the disaggregations and other changes have really happened on this. Over to you, Max.
All right, thank you. And I think it's back to Nick at this point. So I'm just make sure he's ready to go.
Yep, I'll just share my screen again. Okay, just really quickly, I did want to discuss that this everything that we've talked about today is also supported by Android. And now what you'll see here is actually, it's just one app, and all the various data models that we've talked about are available. So you can see here that the various surveillance programs that we talked about in Tracker, we have the COVID-19 cases, you can see events in brackets, the event program that Yuri discussed, as well as the surveillance report that Patrick presented at the very bottom here. This one right here that I just highlighted. Okay, these are all available within the same application. So I'll just go into one of these real quick just to show some of this. Okay, so what we can see here on this app, we can see here the current cases that are registered. This kind of green icon means that these are synchronized to my device. If I have a lot, then, you know, oh, sorry. Not great. Yeah, I am using this training platform, which allows me to display the screen. So it's a bit different than the normal app. That's why sometimes this happens, because the normal app does not allow you to take screenshots or display the screen. So yeah, so we can see that the current cases here. I'm just gonna open one that's already existing. Okay, this person here, you can see that it follows the same kind of output as the program that I originally presented. There was a clinical examination. This person had already completed that, a lab request to lab results, health outcome stages. Following the same format as the program that is online, we are able to, you know, let's say we want to enter details on the outcome for this particular individual, and they've recovered. Okay. Yeah. So we can enter all the same details that we could on the packages as they were set up on the web. Okay. And yeah, we can see that in action. And of course, you know, while there is a list, you might either be searching for cases or you might be maybe entering new cases. So we could see here that we are also able to find those cases. So I'm just using an ID to search. So the ID is unique. This allows me to find the case. You can see this person at the bottom I've found very quickly. We have some data on them already. We could, of course, add more information to this particular individual. So it's very brief, but I just did want to comment that you know, we do have this working for Android. Android is supported For each of the data models that I discussed, as we can see here, all the different kind of models that we discussed are within the same application. This little gray, the box changed to gray, it just means that the data is stored on my device locally. I can, of course, send this data then and upload it. So it's changed to green now after I've sent the data, now that it's saved online as well. The nice thing about Android is that it does have a lot of offline support. So we can do a lot of things offline. I'm not going to disconnect it now because in order to show you my screen, I'm connected to the internet, which would disconnect this. But you can, there's a lot of offline support as well to do a lot of this stuff on Android offline as well, which is a very nice feature where you're able to download a lot of your cases to your phone. You could follow up with them as needed. And then when you have internet, you can, of course, then send them back and synchronize everything online. Okay. So yeah, if there are any more questions about that stuff, please post them on the community. I'm going to hand it back over to Rebecca, who's going to just go over some of the resources and wrap up the session here.
So hi everyone, I know we're a bit short on time, but I hope the demos were useful, and just wanted to emphasize that this work is really quite dynamic. We've been making some rapid changes, so far we've been releasing once per week, and we have one more release scheduled for tomorrow. So we're really depending on the feedback from users and countries and our active community. So Max has up here just a reminder that the best source to go to is, of course, our DHIS2.org/COVID-19. This is where we are updating all of the packages and also the links to the documentation. So as my colleagues have mentioned, we've developed and configured these packages to be as generic as possible and based on the global normative guidance from WHO. But even this guidance it's a moving target as we quickly learn about this disease, and the WHO has updated their guidelines on March 20th. So tomorrow we are releasing some updates to packages to reflect that new guidance. It includes case definitions, it includes some new updates to the aggregate reporting recommendations as well. I think an important piece is that we know that these packages, they need to be adapted to our field realities, particularly to local workflows and local processes. So to give you a sense of some of the documentation we have to help, each package, it includes a system design guide, and this documents the use case that we designed for, and it kind of lays out what our assumptions were and what is the workflow, what are the typical users, but these need to be considered for field context, of course. So I would recommend going to these system design guides to understand the package and how it was designed. And the packages, they are designed that they can be installed as standalone. Maybe a country only wants one package, the case surveillance, and that's good enough for them. But often countries will make various combinations. So the packages are optimized. As an example, the case-based surveillance tracker and the contact tracing program have a relationship between the two. So as Nick showed you, once there is a confirmed case, the next point in the workflow is often that you're going to enroll all of the contacts to support the follow-up. The next piece I wanted to make sure everyone knows about is the installation guide. This is a bit more technical. So the system design guide is quite conceptual. If you're not an especially technical DHIS2 person, you would still be able to understand that guidance. The installation guide is really about how to prepare the metadata file, import it, how you need to make some certain configurations, and then some guidance on adapting that metadata after being imported. So this is largely for DHIS2 implementers in the field. Just to give you a quick heads up, the new releases that we are targeting for tomorrow, we have updates to the case-based surveillance and the aggregate surveillance packages to align to the new WHO guidance on March 20th. So we will also be updating the system design guides to make that very explicit, what has been changed and linking to the guidance that we referenced. We have some improvements to the contact tracing program as well, and this is a great example of how our partners in the field have given us some quick feedback. So this is from Uganda and Togo. We're creating a separate stage now for repeatable follow-up, because we know that with the contact tracing, Often the workflow might be not just to confirm that you followed up with the contact, but actually make contact with them for 14 days to understand whether or not they've developed symptoms. The new ports of entry will be released for the first time. So it's essentially the Sri Lanka design, but we've made some small updates to make it a bit more generic and also to link with the other packages. And we also have translations underway. So there should be translated packages available in French, Spanish, and very soon Portuguese as well, also in the coming days. And we have some of this on the community of practice. We'll post some more links, but we have much more robust translation services now, so we can be sourcing these translations from the community and update these packages to be available in countries where they're needed. I guess probably just the last piece, we will be sort of balancing our release cycle. I would say that after tomorrow, we have all of our base packages essentially released, but we know that guidance is often changing, and we're also getting some very important feedback from the field that may consider how we design the generic package. So with that, we might end up moving to maybe 2-week release cycles. We will have to see. And the next most important thing that we're focusing on is developing training materials to really support the rollout on this. The system design guide, the installation guide, this is really just the very beginning. Where we need to be working next is data entry manuals. An Android manual is being developed, some data analysis guides for the indicators, the dashboards, and how indicators may be updated, modified, some configuration guidance for servers, particularly in places where a tracker package might require a new instance. And finally, just some package installation and translation guidelines. So these, I just wanted to let you know, are underway, and we hope to be rapidly updating the COVID page as much as possible. And all of these updates will also be posted on the community of practice. So I hope that everyone who's been here will be able to participate and give us your feedback. We try to be as responsible as possible, and these inputs from the field really help us to make the package as user-friendly as possible. So just a thank you in advance for your support.